For an organization to gain a competitive edge, its senior leaders need to be able to explain and comprehend the operational environment. The surroundings in which modern firms operate today can be classified as either physical or cyber. In light of this, good morning to you all. My name is Shima Felix, and today we'll discuss the Augusta Medical Hospital Organization, cybersecurity policy, and executive summary. But first, let's take a closer look at the Augusta Medical Hospital overview once again. Now, the mission, vision, and values basically include that and says that at Augusta Medical Hospital, patient care, education, and research are our top priorities. This suggests that here in Augusta, Georgia, we offer you state-of-the-art medical specialists, cutting-edge research, and the newest what advancements. And to support secure access to databases containing patients' medical records, including electronic medical records, personal health records, and protected health information, basically improve patient diagnosis, enable staff efficiency through medical tracking, and facilitate access to systems for pharmacy, radiology, and labs, as well as the transfer of EHR to other medical providers. The medical systems must be integrated with the current medical system. Now, patient health information is protected under federal law by the Health Insurance Portability and Accountability Act, that is HIPPAA. You must ensure your systems comply with healthcare cybersecurity requirements if you offer cloud hosting services to healthcare providers. The ultimate goal of the cybersecurity laws discussed here is to enhance the global digital society. There are ways to make compliance inside your client's business more practical and boost the effectiveness of your compliance offering, even while monitoring compliance with these requirements may seem difficult and real time consuming, requiring a stack of different solutions to meet compliance. Also, a state law known as the California Consumer Privacy Act, that is CCPA, was passed on July 1st, 2023. This law requires businesses to give customers access to and control over their data to protect the personal information of California citizens. This law, like the GDPR, applies to businesses operating in California as well as to any other entity that wants to interact with Californians or their organizations. These serves as illustrations of the procedures and standards used in the development of various other standards. These are also some additional procedures we have identified. In other words, identify a need first. Either the patient or the practitioner may do this. For example, new standards may be needed to reflect the new reality as a result of technological development in the remote monitoring of health issues. A project proposal to develop a new standard or update an old one is presented when a need has been discovered. We have committee. Experts in the relevant subject set or review standards. They comprise a technical committee made up of researchers, healthcare professionals, patients, and families. We also have study. The technical committee drafts the new or amended standards outlined after conducting the preliminary study. This initial task can be done largely from a distance. We have the consensus. Technical committee members formally convene in person to endorse a draft. Therefore, it is made available for public scrutiny. To move forward further, this consensus is needed. We have the public review, presenting the updated or new standard for public evaluation is the next stage. Feedback is always sought to raise the quality and guarantee that standards consider all pertinent facts and viewpoints. We also have approve. Following public review, the standard is returned to the technical committee for any necessary revisions based on comments received. Excuse me. The technical committee must grant final approval before the new or amended standard can be formally released. It is available for purchase and integration into the practices of healthcare organizations and providers. Now, the information staff and senior leadership stroke management of the organization should draft the executive summary and cybersecurity policy. We're going to be seeing this as we go on ahead in this presentation. Regular reviews and updates of the policy are necessary to reflect evolving business requirements, technological advancement, and threat landscapes. A review of the organization's cybersecurity posture and any areas of concern should be highlighted in the executive summary, which we are going to see. Now, in the organization's NIC cybersecurity framework, we have different phases, or should I say, different stages. Now, the first we can see is the identify stage. Now, this consists of identifying all of the organization's assets and being able to identify threats and vulnerabilities related to them by our business objectives. Augusta must basically create an asset registry. We have protect. After all assets have been identified, precautions, okay, precautions must be taken to protect them. These particular precautions will cover things like data security, employee training, and access control. We also have the implementation tiers within the cybersecurity framework. Now, due to the development and implementation of multiple cybersecurity risk management methods, such as the IRP, security awareness, and periodic risk assessment, Augusta presently is ranked in the tier 3, which is basically representative of the implementation tier. Now, in our current profile is comprised of multiple threats with a high probability of occurrence and severe potential impact as determined by our current vulnerabilities. This possible influence affected what humans as well as technology within the organization. But again, we were able to recover from this and respond to this what absolutely and effectively and efficiently, because we made sure that the different tools were what given to the organization, provided for the organization um, departments to help what remediate and mitigate all of these threats and risk. Now, to ensure proper protection, the cybersecurity policy of the firm should be in line with certain requirements. When creating its cybersecurity strategy and stance towards other organizations, the organization should also take into account other standards, such as those set forth by the Institute of Electrical Engineering, IEEE, and the International Organization of Standardization, that's ISO. Now, four distinct functional areas should comprise the organization's cybersecurity policy. You can say that for sure. Internet security, information technology security, data privacy, governance, and incident response. Specific implementation stages for each functional areas are necessary to help meet the organization's needs, which we previously mentioned. Risk management, detection and reaction, control and mitigation, and compliance and future planning are few possible stages, additional stages. The company's cybersecurity policy, that's Augusta Medical Hospital, ought to have a profile always. This profile helps in addressing different needs, which we mentioned. That profile we gave previously will help what identify the needs and also what reach out what in satisfying those needs for the business. Now we have the cybersecurity life cycle, or cybersecurity framework and methodologies. Now, in the life cycle, you can see we have different phases. They identify, protect, detect, respond, and recover. Now, in the identify stage, this basically comprises of the determination of the kind of risk that each organization faces and identify its essential assets. Now, protect, in other words, this comprises of various steps that are taken to safeguard specified assets. In the dictate phase, this involves taking steps to find evidence of systemic penetration into organizations. In the response phase, this entails creating strategies to counter-react cyber attacks efficiently to minimize downtime and their detrimental consequences on the various systems within the company. Then we have the recover phase. In this phase, these steps are being taken to guarantee a timely and complete restoration of BCP and IRP operations. Now, within, let's take a look at the different methodologies to help establish a cybersecurity program. We have many different types of methods in which you can accomplish this. For example, we have the conduction of a security risk assessment. setting our security goals, evaluation of our technology, selecting a precise security framework, reviewing of security policies and guidelines, creating a risk management plan, implementing our security strategy, and evaluating our security strategy also. Now, a cybersecurity policy should be created with the organization's strategic objectives in mind, offering a framework for risk management related to what cybersecurity. The following, there are other what ways in which you can do this. Now, we have the significance of cybersecurity within the company, the significance hazard, the different hazards that the company is dealing with, the method used by the organizations to control cybersecurity risk. An outline of the cybersecurity policy and the synopsis of how it will help the firm achieve its strategic goals should be included in the executive summary, which we will see again also. And we are already seeing it, we're seeing this right now. These different stages, this life cycle will help Augusta Hospital not only grow but also be in a step by step organization to help what resolve any issue, any cybersecurity issue within the organization. It either is a hack or a data breach or a data leakage within the company. This life cycle, these methodologies will help mitigate those threats and risks. Now, within the basically businesses, okay, by guaranteeing the information and data that are protected and preserved against not only illegal access and theft, but also hackers and intruders. The organization's cybersecurity policy should complement the demands and goals of the businesses. Businesses of today rely heavily on technology, and this means that they are susceptible to a wide range of harmful cyber attacks. Cyber attacks affect company operations, which can have detrimental long-term effects such as manufacturing delays, supply chain interruptions, and decreased income. To accomplish this goal, a corporation must take a proactive stance that bases organizational security policies on the fundamentals of business operations. By guaranteeing that information and data are protected and preserved against not only illegal access and theft, but also hackers and intruders, the organizational cybersecurity policy should complement the demands and goals of the business. Now, technical requirements are the elements needed to provide a system with the necessary behavior or function in order to meet the standards and needs of the user. They are related to software development and systems engineering. Now, system, software, electronic hardware, and software-driven electronic devices are examples of technical needs. Requirement analysis, sometimes referred to as requirements engineering, is an interdisciplinary branch of engineering that deals with the creation and upkeep of complex systems, and it includes technical requirements. We are able to specify several technological requirements, including data quality, information security, performance, authentication and authorization, and accessibility, as you can see in the network diagram and data flow diagram above. Now, these technical specifications aid in protecting the data that flow throughout the hospital network. Data is tagged based on its kind, level of sensitivity, and potential value to the organization in the event that it is lost, stolen, or altered. It assists the company in appreciating the worth of its data, identifying potential dangers to the data, and putting controls in place to lessen those risks. As you can see, this is what these different network devices are doing. You can see you have the switch, you have the servers, and also you have the different devices that are connected towards these hubs. These devices help in regulating data. True, that's true. But also it aids in identifying those spots in which danger can what appear in or that are threatening the most. This will help the organization to what prioritize the risk in the incident response plan, which we're going to see later on. It will help identify those risks and dangers and then help mitigate those risks immediately that is identified. Now we're going to be seeing some different diagrams, um, some additional diagrams that are different in different phases of the network diagram and also the data flow diagram. Now, this is the full and complete network diagram of the Augusta Medical Hospital. You can see inside the Augusta Medical Hospital, you can see different segments. You can see the internet with the firewall. You can see also the DMZ area where the hubs are connected to the switches, and also the different departments in those hubs are connected to the network directly. This will help us not only for the safety of the people, but also it will help provide different protection layers in which what threats can be mitigated easily, and also risk in preventing hackers from entering and viewing the um the um the sensitive information of the organization. Now, this is just a layout of the network diagram of the Augusta Medical Hospital. A simple layout. Now, this is a data flow diagram level 0 of Augusta Medical System. You can see we have the different people that are within the hospital management system. You can see the administrator, the staff, the patients, and you can see this like it's like a life cycle that is what building around each of these parties. You can see reporting and also payments directed from the patient and administrator towards the system. In other words, the system is regulating all of these actions within itself. Also creating and adding of different records, and also discharging of bill within the staff and also the system. And remember, this is like a circle, so it continuously goes on and goes on. Now you have the level one, the data flow diagram level one of Augusta Medical System. Again, this is just a build up of the website itself, in which the administrator is able to log in, not only log in but also provide its credentials in order to gain access to the system, in which you can view different details of the doctors, the patients, the different tests that are taking place in the hospital. Again, these are sensitive information that should not be released to anyone unless you have the particular credentials to gain access to the information. And this is why you can see the data flow diagram highlights the process in which this takes place, like beautifully in the organization. Then we have the data flow diagram level 2 of Augusta Medical Hospital. Now this is just like the previous data flow diagram we just saw. Only that we can see that we separated the phases into the two different parts to make it more organized in a sense. Now, the risk assessment and business impact analysis of Augusta Medical Hospital comprises of the patient record system, which is basically too important to function without and unable to tolerate a pause within the organization. We also have the care management protocols. Now, one more system that this is one more system that is crucial to our evidence-based care, workflow automation, clinical decision support, etc. We also have the automated medication administration. Now, this is accountable for eradicating pharmaceutical delivery problems, which is basically a downtown in which a downtown will thus be disastrous. So a downtown should not take place within this stage and process. We also have the nursing resources. Now, this encourages the effective operation of nurses despite a low nurse to patient ratio. So you can see this is very, very important within the organization. Even though, yes, it's part of the risk assessment, the business impact analysis and the risk assessment plan, but these different risk and analysis we are taking notes, these can really have a big effect in the organization growth and also what protection. Now, the business continuity plan of Augusta Medical Hospital, in other words, these comprehensive studies are offered by Augusta's BCP on how to keep business operations running during both short and long-term outages. Now, a disaster recovery plan, which includes procedures for managing IT interruptions to networks, servers, PCs, and other devices, is a crucial part of the business continuity plan. Disaster recovery, continuous operations, and high availability are the cornerstones of our business continuity plan. Now, An organization's possible security threats can be found, examined, and managed using risk assessment, which we just provided previously. These different weaknesses, different openings are found and are realized within the risk assessment, and that is why the risk assessment plan is very, very important. It involves putting weaknesses into categories and calculating the likelihood and impact of every potential risk. Now, these are the different standards and the different framework that we can view within our organization. We have the GDPR, which is basically a regulation from the EU that applies to all businesses operating within the EU. We have the California Consumer Privacy Act, which is basically a California statute that governs the operations of all organizations in the states. We have the Payment Card Industry Data Security Standard, that's the PCI DSS, a rule that credits it's basically a rule that credit card companies create to safeguard cardholder data. We have the NIST, which is basically in charge of creating the framework for NIST cybersecurity policies. We have the HIPAA, which is a framework for regulatory compliance for people working in the healthcare sector. We also have SOX, which is basically a piece of legislation that focuses on controlling accounting and openness procedures within businesses. We also have FedRAMP. Now, this is a framework for regulatory compliance designed exclusively for US federal agencies to protect their data and cloud services. Organizations can enhance their cybersecurity growth and posture by implementing these various sort of standards. Laws, rules, policies, voluntary standards, and standards based on frameworks are a few examples of these. Laws are binding obligations that have to be complied with at all times. Laws and regulations both have to be followed, but, but regulations are usually more detailed than laws and can be enforced by a regulatory authority. Organizations are free to choose whether or not to abide by policies. Organizations can accept voluntary standards for little or no expense. These standards are created by industry groups like the ISO. Framework-based standards are created by national organizations like the NIST to offer an all-encompassing foundation for cybersecurity defense. Now, the SANS framework serves as the foundation for Augusta's incident response strategy, which consists of following procedures: preparation, identification, containment, eradication, recovery, and lesson learned. Every position and responsibility is spelled out in depth. The response team's needs for all tools, technology, and resources were determined and met. It is recommended that the incident response plan be tested every 2 years or so that the team members are comfortable with their assigned roles. The incident handling and incident plan must be included in the executive summary at all times, and also the cybersecurity policy for the firm. The plan ought to outline the actions to be performed in the case of cybersecurity incidents, and also assign accountability for each step and describe the organization's communication strategy with affected parties. In the event of an incident, a timeline detailing each action should be included in the plan, which we previously mentioned. Now, a crucial component of every organization's overall security plan is cybersecurity. Your company can safeguard its network by adhering to a strategy and response plan for cybersecurity issues. In other words, you can protect, you can detect, you can react, and also you can detect these different risks in order to protect yourself from different other from other from other people outside the organization and other organizations also in case of any hacking or data breach or data leakage. Now, the infographic on digital cybersecurity may be useful to organizations, educational institutions, and individuals who want to promote proactive measures to safeguard against cyber threats and raise awareness to them. Because of this, the Augusta Medical Hospital's infographic on digital cybersecurity efficiency trains both technical and non-technical staff members. Infographics are great tools for raising awareness about cybersecurity since they are easier to read and navigate than standard blog posts or articles. As you can see there, we have different risk implications. We also have we have the top 10 different web application security risk, and also have ways and methods the organizations can develop and implement security for their web applications. These different steps can be found within the infographic, and also they can help communicate the cybersecurity awareness protocols to other people and other organizations effectively, bringing the interest of the organizations into it, knowing the different risk implications that was taking place in the organization and the different web application security risks was based on OWASP. That these are the different risk that we can view within the organization, within the web application, and also what the implications. Now, all of the above mentioned strategies and directions need to be carefully considered at Augusta Medical Hospital. These policies and guidelines will not only support the organization's expansion, but also its ability to safeguard patient medical records, preserve resources, and fend off threats. Now, in the key findings, the present security policy needs to be updated to address gaps that have been found in our business procedures, processes, and technology utilization. In the coverage, all phases of Augusta's business operations are covered with a focus on infrastructure since it is essential to all we do. Following the discovery of possible instances of unapproved access by disgruntled workers, a protocol was developed mandating that all disgruntled workers be deactivated from Augusta within 24 hours for their termination. In the recommendations, a quarterly or should I say, you can say like a part-time cybersecurity awareness training session is required of all staff members. Also, the incident response team should have access to sufficient financial resources. For individuals who adhere to Augusta security policy while violators, a rewards program ought to be made available. Organizations manage their cybersecurity risk through a process called the cybersecurity lifetime, which we have view, which is very, very important. Our corporate security policy offers a structure for managing our cybersecurity risk, which helps us achieve our business objectives. Our commitment to cybersecurity, our method for managing risk, and our incident response protocols are all outlined in this policy. Our systems and network diagram, which offers a high-level summary of our network architecture, is also included in this policy. We have a strong basis for managing our cybersecurity risk thanks to the various standards that are in place and our organization's NIST cybersecurity framework, with a clear structure outlining our approach to risk management and incident response plan. Our security policy serves to support the business objectives. We present our findings in our executive summary, as we have mentioned. Please, if you have a question, you can ask. Thank you.